Thank you. Good morning, Miriam. My name is Samantha, and I'm the nurse that will be looking after you today. How are you going? It's good. I'm just going to read your patient notes, if you just give me a quick moment. Thank you. Okay. Miriam, I can see that you've fractured your ribs and we're due to give you some morphine for the pain today. Before I start any of that, I'm just going to get you to tell me your full name and your date of birth so I can just confirm I've got the right patient. So while I do that, I'm just going to check your armband at the same time. So if you can tell me your full name.
Miriam Adib.
Miriam Adib, yep. And your birthday, please?
7th of January 1969.
Great. Just check your MRN number is 174963. 174963.
Yep.
Perfect. And Miriam, do you have any allergies?
No.
Okay, so Miriam, I'm going to ask you to rate your pain. So 1 being no pain at all and 10 being quite severe. So 1 to 10, what would you rate your pain today?
An 8.
Okay, and is it just in your ribs or does it radiate to any other parts of your body?
It's in my ribs.
And how long has this pain been occurring for?
Since my car accident earlier today.
Okay. I'm also just going to check your cannula site just to make sure it's clean and free from infection and swelling. So does it hurt around the area?
No.
And when was it placed in, Miriam?
This morning.
Okay, lovely. That's within the correct time frame. Okay, so I'm just going to do some checks with my nurse and gather some equipment. So I'll be back in just a short moment. Thank you.
Yep.
Normally at this point in time, I would do a full set of obs on the patient, but I won't be doing that today in the assessment, so I will just go right ahead into checking that I've got a valid medication order with my second RN. So today I have a medication order. It is for Miriam Adib. I've confirmed her name, date of birth, her MRN number. She also has known allergies. We're going to be giving her 50 milligrams of morphine in 50 mils. That's for her fractured rib pain. The order has been signed by a doctor. The order has been correctly filled out with the concentration, dose, lockout intervals. It's to be given intravenously. It's not being given yet today. We do have an antiemetic and for any GI upsets, and we have Naxolon in case of too much dosage being administered. So now what I'm going to do is I'm going to check MIMS and the injectables book to make sure that I have everything correct for this patient. Okay. So MIMS, I've got morphine and it's used as a pain reliever. Some adverse reactions are respiratory depression, GI upset. There may be some dizziness or some urinary retention. We shouldn't be using this medication if there are any airway obstruction diseases or respiratory insufficiencies. I'll be checking the dose for a PCA is 0.5 to 1.5 mgs for an adult, and that falls, our dosage recommended today falls within the therapeutic range. So I'm confident that we're on the right track. So I need to dilute my morphine with normal saline. So I'm just going to check the injectables book to make sure that the normal saline is a compatible fluid. And yep, sodium chloride is a compatible fluid, so that is wonderful. I'm now just going to collect my equipment. And I'm going to make my way to the SA drug cupboard to withdraw my medication.
Yep.
Okay, I'm now going to draw out my medication. I'm going to drop the 40 mils of sodium chloride first. If you'd like to check my second arrow, please, I've got 40 mils of the normal saline that I've just drawn up.
Yep.
I'm now going to draw up the 5 vials, which will equate to 10 mils, meaning I've got 50 mils in my syringe. Okay, in the real world, I would remove my sharp, place it in the sharps bin, and then I would recap my syringe with a capped needle to prevent any contamination. I don't have that option today, so I'm just going to remove my needle and I'm going to lay the syringe just neatly here, but as I said, in the real world it would be capped. So I am just going to fill out my additive label. My patient, Mary. my second RN, are you able to please check that?
Mm-hmm. Yep. Good.
Okay, I'm just going to do my second drug check with my second RN. But before I do that, I'm going to put my additive label that I just filled out onto my syringe. So second RN, if you don't mind doing my second check with me.
Mm-hmm.
Today I'm going to be administering morphine to my patient. Her name is Miriam Adib. I've confirmed her birthday, MRN, and she has no known allergies. Today I'm giving her 50 mg of morphine. So we've got morphine, 10 milligrams in 2 mils. The expiry is 10th of the year 2020. I've had to administer 50 mg, so I've had 5 vials. It's been diluted in sodium chloride. It's also within date. So I've got my right patient, right drug, right dose. It's for intravenous administration and it has not been given as yet. I would like to show you the syringe. In total I've used 50 mils of fluid. 10 of those mils were the morphine, the remainder were the normal saline. So do you confirm that there's 50 mils in this syringe?
Mm-hmm.
Okay, lovely, thank you. I am now just going to connect my line to the syringe and place it in the PCA machine. Very tangled. Okay, lovely. I now have a primed line. And I'm just going to pop it into the PCA machine. I'm going to set up my PCA machine to start with before, I'm not going to connect it to the patient, but I'm just going to set it up. So I will need my second RN here to check the process with me. Okay, new patient. Yes, I do have a new patient today. Clear previous patient information. Yes, because I have a new patient. Confirm new patient. Yes. Okay. Now, I've got to start this again.
Go.
So I've popped my syringe with the prime line in the PCA machine. I'm now going to get my second RN while I set this machine up to check over the details with me. Okay, so I have a new patient. Yes, I do. Confirm new patient. Yes. Okay, so drug name, morphine. That's great. Drug concentration, we have got 1 milligram per mil, 1 milligram per mil, that's wonderful. Our PCA dose today is 1 milligram, PCA dose 1 milligram, that's great. Lockout period, we have a lockout interval of 5 minutes, lockout period 5 minutes, that is also correct. Okay, we do not have a continuous dosage today. Our maximum limit is 12 milligrams per hour, so I'm just going to change that to 12 mgs per hour. Okay, 12 milligrams per hour. Per hour, my delivery is stat. So I am confident that the details I've added into this machine match the details on my order. Okay. So what I am going to do next will be my second patient check and then my third and final drug check. Okay. Hi Miriam. I'm back here. We're about to hook you up to the pain medication for your fractured ribs. Before we continue, can I just get you to tell me your full name and your date of birth again, please?
Miriam Adib, and my date of birth is 7th of January 69.
Perfect. I'm just going to check your MRN number on your wrist. We have 174963. 174963. And Miriam, do you have any allergies?
No.
Okay. So nurse, as my RN, are you able to do my third and final drug check with me?
Mm-hmm.
Okay. So we've confirmed twice. We've got Miriam Adib, her birth date, MRN are all correct. She has no known allergies. Today we're going to be administering 50 milligrams of morphine. I've got my morphine 10 milligrams in 2 mils. The expiry is not until 2020. And I've got 5 vials of that, which make up 50 mg. It has been added to 40 mils of normal sodium chloride. It is also within date September of 2018. So I have the right patient, right drug, right dose. It's going to be administered through the PCA machine, which is intravenously, and it has not been given. Stop, please.
Sorry.
You whispered something to me.
Syringe. You need to check the medication as well. But
Right,
I can see the label there.
Okay, so I'm going to do my third and final drug check with my second RN. I've just confirmed with you the patient's name, date of birth, MRN number, they're all correct. Miriam has no known allergies. Today we're giving morphine, 50 milligrams. So I have got my morphine vials. They are 10 milligrams in 2 mils. They don't expire in 2020. I've got 5 of those vials to make up the 50 milligrams. The morphine has been added to sodium chloride. It is also within date, September 2018. I have the right patient, the right drug, the right dose. It's to be given intravenously and it's not being given. If we just have a little look at the syringe, you can see that the 10 ml of drug plus the 40 ml of the normal saline equals to 50 ml of fluid.
Mm-hmm.
Okay, so I've done my second patient check, my third drug check. Now I am just going to wash my hands, pop on some gloves and connect the line to my patient. just going to clean your cannula site, Miriam, before we attach all this together. We're all connected. So Miriam, I'll just explain how this is going to work. So we're giving you morphine today for your pain from your fractured ribs. And what's going to happen is I'm going to give you this little buzzer. Now, every time you press the green button, it's going to administer a small dose of morphine to help with your pain. You can only press the buzzer once every 5 minutes. So I'm going to pop that at your bedside here. I'm also going to come back in 15 minutes to check on you. If you need anything within that 15 minutes, I've got your nurse's call buzzer just down by your other hand as well. Do you have any questions at the moment?
No.
No? Okay. I will just pop the machine on so you can start when needed. So you're all set up now, Miriam, like I explained to you. If you feel the need to administer yourself some of the pain medication, you just pop the green buzzer. It will only allow you to administer that to yourself once every 5 minutes. Nurse call buzzer is on your left-hand side if you need me for anything, but I will be back in 15 minutes. So I've concluded my interaction with the patient. Just going to wash my hands, dispose of my and I am just going to fill out the chart. So today is the 23rd of the 3rd, the time is 10:35 and I have signed that off. Nurse, as my second RN, if you're able to please just check that's correct and sign off for me.
Mm-hmm.